This is Diana Bitucci. I am your host and a diabetes specialist, and I want to share all of my knowledge with all of you worldwide so I can help you manage the disease of diabetes and so we can beat this together. Before I go on to talk about high cholesterol levels and how you can better manage your cholesterol levels and why it is so important to do so, make sure you guys subscribe to my channel and make sure you guys share this video with others that you think can benefit from watching this. So we know diabetes is a complex disease and it affects a lot of different things, a lot of different organs, and of course arteries, which feed organs as well. So diabetes can cause diabetic dyslipidemia, also known as hypercholesterolemia, high cholesterol. You may know it as many different terms. Cholesterol is present in every cell of the body, and it is important for natural functions when it comes to digesting food, producing hormones, and generating vitamin D as well. So believe it or not, we all need cholesterol in our cells for our cells to function. Cholesterol also comes from the foods that we eat, and pretty much it is waxy and fat-like in appearance. And there are two types of cholesterols. We have the low-density lipoproteins known as the LDL or the bad cholesterol, and then we have the high-density lipoproteins known as a good cholesterol. You want to think of L for lousy and H for good, or H for high. The higher the better. So that is a good cholesterol. You're probably wondering, well, what are these levels supposed to be? So normally the total cholesterol we want under 200 milligrams per deciliter. LDL normally we want less than 100 milligrams per deciliter, but believe it or not, for diabetics we actually want the LDL to be under 70 because we know that diabetes and having high cholesterol can put you at much higher risk for developing a heart attack or a stroke. We normally want to minimize the amount of bad cholesterol, also known as LDL, in your bloodstream, so we strive for 70 or below. What are some foods that you can include? And what are some foods that you can avoid if you are trying to get your cholesterol levels under control? So some of the foods that you should include would be avocados. You can do barley or whole oats. Flax seeds are also good. I have a video on flax seeds, so you guys can watch that one as well. Soybeans, blueberries, salmon also has a lot of good fat and omega-3, which is actually good for your cholesterol. The CDC also recommends that we want to eat more of low dairy fat. So you always want to buy low fat or reduced fat as much as you can. We need to include more beans, and normally we want to include foods that are higher in unsaturated fats, such as olive oil or healthy nuts. Foods that you should avoid if you are trying to control your cholesterol levels would be red meat, full-fat dairy, margarine, hydrogenated oils, and baked goods. Of course, anything fried is going to be not a good option, so I normally recommend avoiding fried foods as much as you can. We want to limit alcohol intake, believe it or not. We want to follow the CDC guidelines, and the recommendation for males is no more than 2 alcoholic drinks per day, and for females it is limited to 1 alcoholic beverage per day. Exercise is always crucial. The more we exercise, the better it is. So I normally generally recommend about 30-minute walk every day, bicycling, running, jogging, whatever it is that you enjoy doing, make sure you're doing more of it. The key is to avoid sitting down and just kind of laying around. Of course, that the food kind of just stores more fat and we are not able to burn that fat the way that we should. Key points that I want you to take from this video, everyone, is you want to eat a heart-healthy diet. You want to exercise regularly, you want to avoid smoking, and of course, try to attain and achieve a healthy weight. Make sure that you are following the BMI chart and trying to stay between 18 and 25 on the BMI as that is recommended to try to eliminate, obviously, and manage your cholesterol, but also to maintain a healthy lifestyle and of course eliminate the possibilities of other diseases that come with being overweight and obese. So I hope you guys enjoyed this video, and if you did, please give this video a thumbs up. share this video with others, and comment below, and I will see you guys all on the next video. Take care.